Here, pathology. Topic is immunohematology and blood banking. What is immunohematology? What is immune? Immune system is a consist of antigen antibody reactions. Then hematology, the study of hemoglobin is known as hematology. Then blood banking. Blood banking means is the collecting of the blood groups is known as blood banking. What are the agglutinogens and agglutinins? What is the difference between agglutinogens and agglutinins? Agglutinogens means these erythrocytes of a person contains some antigens called agglutinogen. Agglutinogen is a present in the erythrocytes. Erythrocytes means is a RBC, red blood cell. So the antigen present in the RBC that is known as agglutinogen. So agglutinins means is the antigen are allowed to react with corresponding antibodies called as a agglutinins. Which which type of antibody react with the antigen that is known as agglutinins. So difference between agglutinogen only present in the RBC is the agglutinogens, and agglutinins means is a react with the react with antigens is known antibodies is known as that's called agglutinins. Then what is agglutination? Agglutination అంటే గుచ్చీకరణము. What is the గుచ్చీకరణము? This principle blood grouping is based on agglutination. Agglutination is process of clumping when normal human blood cells containing unknown antigen will react with corresponding antibody. So that is called agglutination. Agglutination means antigen antibody reaction. ప్రతిజనక ప్రతిరక్షక చర్యలని అగ్లూటినేషన్ అంటారనమాట. ప్రతిజనకం ఉంటుంది, ప్రతిరక్షకం ఉంటుంది, అవి రెండు కలిసి చర్య జరిగితే దాన్ని అగ్లూటినేషన్ అంటారు. దాన్ని యాంటీజన్ యాంటీబాడీ రియాక్షన్స్ విత్ ఇన్ blood sample. Then what is the antigen antibody reactions? Antigen antibody reactions consist of is the blood groups. Which purpose means is the antigen antibody reactions ఇందులో జరుగుతాయి కాబట్టి బ్లడ్ గ్రూప్స్ని యాంటీజెన్ యాంటీబాడీస్లోకి చేర్చారన్నమాట. సో ఇన్ ద ఫస్ట్ పాయింట్ ఈజ్ ఇన్ బ్లడ్ ట్రాన్స్ఫ్యూజన్. సెకండ్ థింగ్ ఇన్ ప్రెగ్నెన్సీ. Third one is investing cases of patient disputes. Fourth one, medical legal value. Then what is the major or minor cross matching? This is the second type of grouping. That means is a blood banking consists of a cross matching test. Cross matching test especially very important of the collecting to the blood donors and given to the blood recipients. So major cross matching, the donor cells are mixed with patient serum. Minor cross matching, the patient cells are mixed with donor serum. Clear? The donor cells are mixed. Donor cells mixed with patient serum. Patient cells are mixed with donor serum. This is called is a major or minor cross matching defect is. Then what is the cross matching? What is the cross matching? Cross matching means is a determination compatibility of donor and patient blood is called cross matching. Determining compatibility of donor patient. ఎవరైతే రక్తం ఇచ్చేవాళ్ళు ఉన్నారో వాళ్ళలో ఉన్నటువంటి కంపాటిబిలిటీ అంటే రక్త కణాల యొక్క కలయిక కలిసే దాన్ని బట్టి చేసే పరీక్షనే దట్స్ కాల్డ్ క్రాస్ మ్యాచింగ్. ఇట్ ఈస్ కాల్డ్ యాజ్ కంపాటిబిలిటీ టెస్ట్. దాన్ని ఏమంటారంటే కంపాటిబిలిటీ టెస్ట్ అని కూడా అనవచ్చు అన్నమాట. సో దీంట్లో దిస్ క్రాస్ మ్యాచింగ్ టెస్ట్ ఎస్పెషల్లీ one is chemical is very important, that is known as EDTA, ethylene diamine tetraesteric acid is a very important of this chemical compound in the blood coagulation. So explain about human blood group system. There are nearly 300 blood group systems so far discovered. అయితే ఇప్పటి వరకు 300 బ్లడ్ గ్రూప్స్ని వీళ్ళు ప్రస్తుతానికి కనుక్కున్నారన్నమాట. The ABO and RH are major clinical significant and the most important of the blood group system. సో ఆల్ బ్లడ్ గ్రూప్ సిస్టంలో ఇప్పటికి వరకు ప్రస్తుతానికి అయితే ఏ గ్రూప్, బి గ్రూప్, ఓ గ్రూప్ అండ్ ఆర్హెచ్ సిస్టమ్. RH system is a negative, the determined by negative and positive determination of the RH rhesus monkey. All the people of this depends on the reactions obtained by mixing their red blood cells with two different reagents known as anti-sera A and anti-sera B. So the blood group is a very important test in the clinical laboratory. Why? Because each and every one patient in seriously they can go to the surgeries. So first of all, they can doing the surgery in coagulation of the blood or positive or not. So this is the identification of the this test is a blood grouping test. So this is test especially depending upon coagulation or blood in the compatibility of the human person. So this depends on the reaction obtained by mixing their red blood cells with the two different reagents known as anti-sera and anti-sera B. So anti-serum consists of A type of antibodies, B anti-serum consists of B type of antibodies, and O consists of serum consists of O type of antibodies. This is known as D also. Then RH is a factors is determined by positive or negative. Then define hemolysis. So this is the antigen antibodies presence in the antiserum. So the blood is consist of antigens. So the reaction antigen and antibody, the clumping of the blood is known as blood groups. So define hemolysis. Hemolysis, this process of breakdown of RBC and release of hemoglobin known as hemolysis. Hemolysis. What is mean by Bombay blood group? Bombay blood group. A person lacking absent of H gene cannot produce H substances and unable to produce either A or B antigens even if possess present. A B gene is obviously lacks A B on antigens and described as a Bombay individual and his blood group is said to be Bombay blood group. H gene is a inherited independently. Clear? Explain about RH factor. R factor is a very important agglutinogen discovered by human blood cells by Carl Landsteiner and Wiener in the year of 1940. So it is a agglutinogen of the rhesus monkey. There is a corresponding agglutinin in human plasma when the red cells of Macacus rhesus monkey were introduced in rabbits. So guinea pigs antibodies were evoked. This caused clumping not only monkeys red cells but also red cells about 80% of human beings. Then the agglutination, especially rhesus monkey factor is a positive and given the negative factors. So then next blood grouping estimation. Then first of all you have to see here what is the aim to know the blood group of the given sample. Method, slide method. Principle, the procedure is based on principle of agglutination. Principle is a based on agglutination. Normal human blood group cells containing unknown antigen will react with corresponding antibody known anti-sera and clumps are formed. Clear? Reagent anti-A-sera blue color, anti-B-sera yellow color, and normal saline colorless 0.9%. Requirements: glass slide, pressure pipette, applicator sticks, centrifuge, specimen, anticoagulated blood. Procedure: prepare a 10% cell suspension of red cells in normal saline. Preparation of 10% cell suspension. Mix 5 drops 0.05 ml of sedimented red cells with 2 ml of normal serum. Centrifuge at 1500 rpm revolution per minute for 1 to 2 minutes. This is called supernatant. And 2 ml of normal saline to the sedimented red cells mix well. This gives 10% cell suspension. Okay, clear. Procedure is blood grouping, anti-A blood grouping serum and anti-B blood grouping serum. Thank you, all of you.